In today's episode, we'll be learning about the concept of Pharma 4.0 from Christian Wölbeling of Werum. Christian, welcome to the...
Yeah, thank you, Barbara, for inviting me. My name is Christian Wölbeling. I'm working in IT for more than 27 years now, so I saw a lot of pharma companies already, and as a senior director, I'm currently working in the space of automation and helping pharma companies, global pharma companies, smaller pharma companies to get paperless. So that's my mission, and of course this brought me to Pharma 4.0. So this story already started off some years ago. I guess it was 2016 when I was in Basel with a ISPE conference we did from the German, Austria, Switzerland affiliate, and we recognized that there's a lot of interest into automation and pharma. And as we all want to get paperless here, the question came out: how can we organize now better our business processes? And we said, okay, we have to automate them. We have to get the processes more integrated. We have to integrate our equipment. And the idea of the plug and produce was actually the first idea around that. So this meant at that point of time that we said we need an easy integration of equipment. So taking the equipment, taking a USB stick like you have it with your printer, you just plug it into your computer, and then by magic everything is configured and the system is up and running and knows, the computer knows what the printer can do, and the printer knows what the computer can do, and they are aligned and set up completely. And this is a big dream we have still in our working group to make this happen, that we can take a packaging line, just plug it into an electronic system, into a line management system, for example, and then it will automatically be qualified, validated, so that it is ready for you to use in such a GMP environment.
So before we started introducing Pharma 4.0, what were people using? So why is this different? Why is there an advantage to using Pharma 4.0 versus what we were doing in the past?
Yeah, this was actually now the start of this initiative, and we thought, how can we make this happen, right? And at that time, you have to know that we had in Germany this big Industry 4.0, we call it, initiative, and this initiative was more or less cross-industry. It was out of pharma, it was to optimize cars industry, it was for chemical and other industries, semiconductor, of course, and the idea of Industry 4.0 was to have a complete environment automatically configured, run up and running, and self-learning. Yeah, so you don't have to control what you and plan what you have to do. The environment is adaptive. It can monitor itself. It can control itself. So it will be fully automated. So that actually was the idea. And then we said, okay, when we are having this in place already, and there's the German Acatech study available. You can download it on the internet. I think we will provide this link. And so with this document, there's written already how a system can be set up in an automated way, yeah, self-configuring. And we said, okay, that's a great starting point. Let's take this Industry 4.0 one and make it pharma-specific. This was the idea. So we said, okay, when we have this, we will pick it and make a model out of it. And then at that point, Pharma 4.0, the operating model we call it, was born. Yeah. And this goes back up to in 2017, something like that, where we created this term. And now it was well delivered up to now. Hopefully you know it as well.
We've had a lot of questions from members who don't really know what Pharma 4.0 is. So, this is a great way for us to learn more about it ourselves and for members to learn more, or just in general, the pharma industry. So is Pharma 4.0 a product?
Yeah, I think I have to explain you a little bit what Pharma 4.0 is. Looks like that. So it's not a product you can buy somewhere out of the shelf. You cannot download it in the internet. That's not possible. So this is a model we developed out of this Industry 4.0 one. And this is consisting of elements, we call them, and enablers. And these elements are the resources, the information systems, the organization and processes, and the culture. So with these elements, you can build up a fully automated environment. What we wanted to do now, as this is coming out of Industry 4.0, we wanted to make it pharma specific. So what we said is, okay, let's take this or takes these elements now and links them to pharma. And besides that, we have these enablers, we call them. This is digital maturity. So how can I get a pharma environment with all the paper into the direction of a digital environment? So we said, okay, how can we bring in digital maturity into an organization? And on the other hand, we said, data integrity, of course, is a huge issue currently in the pharmaceutical industry. And we said, how can we create data integrity? So we invented the term data integrity by design, means that due to the processes we are designing, we want to bring data integrity by design from the beginning into it. And that are the two enablers. And so we defined this model. We have a nice logo now developed together with ISPE, calling it the Pharma 4.0 operations model. And the next step was then to say, how do we link it now to pharma? And we looked around and thought, what is now the key issue, for example? What does everybody know? What are the standards in pharma we can look for? And of course, ICH, International Committee of Harmonization, showed up, and we looked through the guidelines at that time, ICH Q8, Q9, Q10, Q11, up to Q12, and we recognized the pharma quality system is the best one. So we looked a little bit closer into that one, and we recognized that with the pharmaceutical quality system, we had a good pattern to automate all the processes we normally have along the life cycle, which is clearly described in this document, and to make it happen now for pharma automated. Yeah? So this was the idea. And so we said, when we have elements and enablers already in this model, so this fits one-to-one very nicely, we said we need new elements and new enablers. This was the idea to say. So actually, what we did is now that we took the elements from the Pharma 4.0 model and matched them directly into this ICH Q10 pharmaceutical quality system model. So this turned out nicely that we had now these new pharmaceutical quality systems elements, as I mentioned, resources, information systems, organization and processes, and culture. And on the other hand, we added also the enablers, the new enablers for the PQS, which are now digital maturity and data integrity by design. And besides that, we still have all the elements and the enablers from ICH Q10. I can repeat them here shortly. So this is mainly as the elements, the process performance and product quality monitoring system. This fits with the 4 elements of the new one. And quality, the knowledge management and the quality risk management, which fits then to digital maturity and data integrity by design. So we found out that this is a perfect match, and we presented this relationship, let's say, at many conferences now, and we just discussed it here also in ISPE already with a lot of regulators, and they were very impressed because they see here now a great synergy between automation and the guidances we have already out there for many years now. Yeah? The point is more, not everybody knows ICH Q10, unfortunately. This is a big issue, and I think this is why ISPE can help here a little bit more to educate so that we know all what a control strategy is, for example, because the control strategy is exactly what we need to make this process happen from development up to commercial manufacturing, right? This is a bridge where we describe the whole product in the control strategy with a quality target product profile, where we have the CQAs, the CPPs in, and then in the next step, we make the manufacturing recipe out of it, which is more or less the control strategy in manufacturing, and that's why we called it then the manufacturing control strategy. So quite a long story, but all fits nice together as we really have a long, let's say, process from getting a new drug product from research to development, process development, and we get the next step then to tech transfer, and then next step is commercial manufacturing. So with having this operating model now, the operating model, coming back to your question, what is it? It is a methodology. It is something what is working out as a methodology to develop a product from the pharmaceutical development up to commercial manufacturing.
Now, you said that it started with a conversation within the doc community, the doc affiliate. So is it very Europe focused, or is it something that can be globally applied, into the Asia Pacific and North America, or is it primarily in Europe for right now?
This model is definitely generic. So we developed this even on the basis of the ICH, which is the International Committee of Harmonization. This is speaking for itself. And so this is definitely something I will not say invented, but where the ideas were formed out of this Industry 4.0 approach. And so saying this, we are open here, of course, for global communication. We have presented this around the world. For example, last year I presented it in 2018 25 times now on conferences around the world, going from Japan to Singapore, to the US, to Europe, several countries. And it was always, as I mentioned, well received, right? So it's definitely nothing regional. It's definitely an international initiative now. The term is quite good and quite well known now. And so the idea is definitely to work in groups which are perhaps locally organized, because we all have travel constraints. We cannot travel always around the world to collaborate. But the idea is now that we have guys in this initiative involved, which can take it now to the different regions, so that we can discuss locally and develop locally this idea, because perhaps we have the same methodology, but we have to apply it a little bit differently.
So this is a methodology. Do we have a lot of real-world examples of companies using this approach, or is that the next step? Is that the future, is actually applying these methods to everyday life?
I think that's an interesting question, because how it is seen currently in the digitalization. Let's come to this point. Digitalization is a big buzzword, and everybody is doing it. Yeah, all pharma organizations have set up digitalization strategies coming from the big consulting companies. Yeah, they are telling them how to do it, how to set up the organization, and all this blah blah blah. But on the other hand, they want to know. We have to know it, and more based on the daily work. So what does it mean at the end for the operator on the shop floor? What does it mean for the supervisor? What does it mean for the QP person? Yeah, nobody knows it currently, and we are looking for the concrete answers. I think that's our mission here in ISPE, and it's very simple that we say, okay, this approach is now helping us to set up, let's say, concrete examples where we want to make it happen on the shop floor. And it is not, and let's explain this way. We have a lot of digital islands. Somebody is trying out augmented reality. Yeah? When you go to these conferences, you can see these exhibitions. Everybody has a small island, voice recognition, augmented reality, artificial intelligence examples. But when you look more closely to that, there's no overarching concept behind that. So that are all islands implemented up to now. Mm-hmm. So the idea of the Pharma 4.0 initiative is definitely to hook it all together. We want to see it integrated in the holistic control strategy from development up to commercial manufacturing, where it fits in the overall concept.
Okay.
So the overall concept, let me also explain this, means for us that when an operator or worker comes in the morning into the factory, he is signing in, he is getting his card or his nice RFID identification chip or whatever he has, and then the system will automatically tell him, hey, today you are in line 5, you will produce these products, and this is what you have to do, this is how you have to be trained to perform it. And in the background, this is all checked. So no surprises when he's starting off his work at this line 5, everything is done, prepared. So he can just start working, and the system knows exactly which are the right orders, what are the batches, what are the requirements he has to fulfill. Serialization is up and running. Mm-hmm. So it is really that we do have now a fully automated process. So this is also going not only in the, let's say, life cycle approach of the product. Pharma 4.0 is also looking into the daily operations processes. Means signing in the morning up to the evening, worker goes home, we have the shift change, whatever, the handover, and all this is controlled by this operating model.
Well, it sounds all very interesting. Because there are a lot of members who don't really know what Pharma 4.0 is up until we've had this discussion, if they want to get involved or they want to learn more about Pharma 4.0, how do they do that? Are there any, do we have any resources that we can share? How do they get the information?
Yeah, up to now we presented this, of course, at many conferences, so just go to the next one from ISPE. Or what you also can do, this is perhaps more easy, just go to the website. We have published there already a blog where we have made these articles we have developed already around what is Pharma 4.0 exactly, what is the holistic control strategy, ready for download. So that is a good introduction where you can read what I've just explained here, so that you get more details around that, can take it home, and also can see the nice pictures we have developed, which is quite difficult currently, just hearing this podcast, but we are more than happy to share this.
So Christian, we've also created an online special interest group in our COP discussion area for members who are interested in learning more and to networking with other interested members in Pharma 4.0. So we'd like to encourage anyone to go to that site and ask a question. And you're a member of that community and others who are involved in this project with you to help answer any questions. So
absolutely, there are more opportunities to get to the next level of involvement. So we have these articles which I just mentioned. So this is for getting to know, let's say. And next level could be, for example, to use the blog, the interactive website. But the other opportunity is also to get involved with our group directly. So we are open here for signing in. And we are also offering then an onboarding session when you want to be a part of our data integrity special interest group. Then we do have a half an hour session where we introduce our group. We have, by the way, some working groups, so perhaps I explain them a little bit. So one is taking care of the holistic control strategy. One is taking care of the maturity model. We have one for the plug and produce, what I just explained with the USB stick. And we have also the process data maps and processing. And we are also thinking now about new validation approaches, for example. So there are a lot of opportunities which we are also going to coordinate now with the camp colleagues, for example. So we don't want to reinvent the wheel here, definitely not. So we want to collaborate, want to use the ISPE platform now to work and to create new ideas and to develop these ideas and to whatever we have at the end. Perhaps we have only an article, or we might have a new guide in some years. We don't know yet. But you can get directly involved, and this is quite easy as we are offering this with local working groups. As I mentioned, we are currently expanding, so we are looking for volunteers, and it's the only good thing what you can do. You have to do it. So when we find volunteers in different regions, we are more than happy to make them, let's say, regional leaders, for example. This is currently what we are thinking about, so that when we have subject matter experts in that area, which can develop further on in this region as well to take over some tasks, we are more than happy to do that.
So they should reach out to you directly, or should they send a message to ISPE? How do they find you to get involved?
I think best way is that if you know me personally, then shoot me an email. I will coordinate it. Otherwise, you can do it via the blog, for example. We will check this, and you can launch an email as well, getting the address, and we will coordinate and invite you then for the next session.
Well, this was all very interesting. I've learned a lot about Pharma 4.0, and I'm sure this will not be our only recording.
There's a lot more.
There's so much more to share. You guys are doing a lot of work, and we look forward to hearing more about what the future holds for Pharma 4.0.
Yeah, so I will be happy to have everybody involved, or anybody who is interested in. Just let us know, and we are more than happy to develop this on.
All right. Thanks, Christian.
Take care. Bye-bye.
Okay. Well, Christian, I'd like to thank you for sitting down and telling us a little bit about Pharma 4.0, and we look forward to hearing what's in store for the future.
Absolutely, and there's more to come, definitely. So we are still working in our groups. We are having a lot in the pipeline currently, too much to explain right now. So stay tuned.
Definitely. Well, thank you very much.
I'd like to thank you for listening to today's episode and invite you to check out our audio library, where you can search for recordings on a variety of topics relevant to ISPE. To find the library or to find out more information about us, visit our website, ispe.org. And if you'd like to suggest a topic you want to learn more about or even be a panelist on this podcast, drop us a note to see how you can participate. Thanks for tuning in, and we'll see you next time. Bye.